My name is Eric Okoth. I'm a physiotherapist by profession, partnering with Ponea Health. So today we like to let you understand what physiotherapy basically is, what we do, and when you may need to visit a physiotherapist, and also to help understand or answer few or all the questions that are frequently asked pertaining what physiotherapy basically is. So to start, we'll basically start with the definition of what physiotherapy is. In a very simple way, physiotherapy is a medical treatment that is geared towards maintaining and restoring the mobility of a patient through physical rehabilitation and also helping in preventing of injury to the patient. So basically what we do is to help you get back to the activities of your day-to-day that you used to do before the problem that you are currently or you've been suffering from, and also to help in educating so that we prevent further injuries in the future that may occur. For someone to consider him or herself a patient that may require physiotherapy services, there are a wide variety of symptoms that when you experience, you may need to visit a physiotherapist. So one, physiotherapy is into a wider perspective. So we can say there are those musculoskeletal, those injuries that interfere with the musculature and all those, the joints and what have you. So when you first feel a pain of joints or any other muscle pain that may have resulted from maybe a knock or just an onset, when you feel like a numbness or a very sharp pain, which we say is a result of that's a result of a nerve impingement or a nerve-related symptoms like numbness, tingling sensations, or very sharp and excruciating pain that you may feel it on either your limbs or the limbs, I mean the hands or the legs. When you feel difficulty in making your movements, like there's some patients that when you might experience pain while bending or doing any exercise that you are used to doing before freely. So when you experience such, you may need to visit a physiotherapist so that we do a group of, we do tests which may include physical through exercises to rule out what the cause of the pain is so that we may help you recover from whatever the symptom you are experiencing. So first, when you walk into a physiotherapy clinic or when you walk to see a physiotherapist, first we'll do what is called subjective examination. So in the subjective examination, the physiotherapist will try to ask you questions on when you started feeling the symptom that you are presenting with, how did you start, which activity that you did that led to the problem that you are experiencing. Then after that, we do a physical examination. So on the physical examinations, we'll try to find out which movement elicit pain or cause pain, or to what extent is the pain. So there we do some of the specific tests depending on what you are presenting with to try to rule out the cause of pain. And in cases where the physiotherapist find that you need a further test, so you are again referred so that you have an X-ray or first so that we see what the problem exactly is. Is it musculoskeletal, or is it a pain that is resulting, a referred pain? So a referred pain may be a pain from somewhere else being experienced on the spot of where you complain on. Thank you so much for joining us in this discussion. We are looking forward to engaging you and interacting you a lot in our future episodes. And you can book my services at poneahealth.com.